Our first speaker is a regular commuter to Washington from California. And if you haven't discovered, in the back of your program, there are lengthy biographies for everybody. And if I read his biography, I would take much too much of the interactive time that I promised you earlier. So instead, I thought I would translate his biography. Basically, what the several paragraphs say is that Dr. Garber is first and foremost a physician. This is my editorial comment. He may choose to amend it later. He's also an expert in the methodologies of research, which is to say how you use the proper technique to get the correct answer, which, while it may sound easy, actually is extraordinarily difficult. Because if you use the wrong techniques, you'll get an answer that may appear to be something that you wish to get, but in reality has nothing to do with reality. And he was recognized as a leader in that, both with his term on the Medicare Evidence Development and Coverage Advisory Commission, or Medtech, as well as his efforts with Blue Cross Blue Shield and others. He's also a researcher, and if you've seen recent issues of the Annals of Internal Medicine, you'll see a few articles that he's written. He's even collaborated with a nephrologist at Stanford for an article, which is hubris of the greatest measure, but that we'll leave that aside. And his research is in outcomes research, which is what can you do to improve outcomes, or what's being done that may not yield the best outcomes, as well as innovative healthcare deliverer. And what his bibliography omits is that from time to time he's also a bomb thrower. And he's written in the current issue of the New England Journal of Medicine, he's written a suggestion as to how to improve the regulation of medical devices, which some people may think is a radical idea, but actually is evolutionary rather than revolutionary, again, in my judgment. But the thing that I think is most important about Alan, and that I learned many years ago when he and I had the occasion to work together on a project in the medical device space, although a very low-tech medical device, is his common sense. And so he takes all of the qualities that and adjectives that I've just used and mixes them together to come up with common sense solutions, which for anybody who reads the daily newspapers here in Washington is a commodity in very short supply. So it's with great pleasure that I'd like to introduce Dr. Alan Garber, professor of medicine and assorted other disciplines from Stanford University, to talk about medtech innovation in a reformed delivery system. Dr. Garber. We're going to go sit where we can see.
Thank you, Bob. That was a great description of what I aspire to do. I wish I could say I've accomplished what you attribute to me. I want to add my welcome to the two that you've just heard. I really appreciate all of you getting up here early to come and meet with us. And I'm going to start with a few caveats about my comments this morning. A lot of what I want to discuss is the implications of health reform for MedTech. And like I suspect many of you, I've struggled a great deal to try and understand what's in the two bills that were just passed. In fact, I don't know if any of you have had the same experience. I was trying to find the final version of the Reconciliation Act, and on Thomas, the government website, there were 4 different versions up. There are now 5, and I think I finally have downloaded the absolute final version that was signed into law. I'm pretty sure that's true, but then I have to confess I haven't read this version all the way through, and that's really short compared to the Senate bill that was passed, which was more than 2,000 pages. So this is a long way of saying, I suspect that every one of you will know in more detail and with greater accuracy at least some parts of the bill than I know about. So I'm going to be presenting the information about health reform with admittedly a very imperfect understanding. But I think I'm going to concentrate on the general direction. And the other thing that, here I am in Washington, I shouldn't be telling you this, but as you know, we're about to enter a rulemaking phase. And to try to determine exactly what the bills will do prior to this rulemaking period may be a bit of a fool's errand. I mean, there are certain things that will be very clear. For example, the subsidy schedule to help people purchase health insurance. That's spelled out in detail in the law. But there is a great deal of vagueness, as is the case with legislation, typically, about how other features will be implemented, and they touch upon the issues that we'll be discussing this morning. So some of this is going to be fairly speculative in nature. And in the last part of my comments this morning, I'm going to deviate a bit from what the law does to what I see as the most exciting challenges for the medtech industry, and I hope that we'll be able to talk about that. And let me add that my perspective is informed in part by my working with CBO. I'm on the panel of health advisors for CBO, so I'm very sympathetic to their task, to how they approach their task. I have a lot of respect for the people there, but I've also been somewhat infected with their point of view. I look at budgets, I look at how you forecast budgets, the methodology, et cetera, and that naturally leads you to ask questions about what anything will do to the federal budget deficit. And I'm going to conclude that maybe in the med tech industry, it's not so important to focus on the care delivery system and the payment system, but what are the challenges that we face as an aging society that has tremendous budget issues, tremendous challenges. I'm really referring to the US, but as you know, this is throughout the developed world, where we've got demographic change, and if the industry can do something to change this trajectory in a favorable way, it will be an incredible contribution. So I'd like you to think a little bit about beyond the health reform bills and think about broader contributions. So I want to take you back to the motivation for health reform, which remains true today, and that is it's really about health expenditures. Now, some of you may say, yes, but the rhetoric was about expanding insurance coverage, and that's really important. I actually am somebody who, throughout his career, has believed very strongly in expanding coverage, but I still see the fundamental issues as being really about value for money. So there are people like people at the University of Chicago, Topel and Murphy, who've argued that, well, we've had great increases in life expectancy. If you monetize that by looking at value of life, value of years, et cetera, since 1970, $95 trillion of increased value. And according to David Cutler and others, these increases in health means that our healthcare has been highly cost effective.